The Healthcare Security Cast is sponsored by 3D Network Technology. Reliability is our core value. Visit www.3dnetworktechnology.com. And by Genetec. Genetec, delivering security strategies for healthcare. Visit Genetec, that's GENETEC.com.
Welcome to the Healthcare Security Cast, the podcast dedicated to healthcare security, safety, and emergency management. If you are involved with a healthcare security program or desire to be, this podcast is for you. Join the conversation as we discuss the issues that matter to healthcare security professionals while leveraging the expertise of healthcare security thought leaders and experts in personal development. And now, here's your host, Brian Hamilton.
Welcome to the Healthcare Security Cast for Tuesday, July the 14th. On today's show, we're joined by IAHSS Board of Directors Member-at-Large, Dan Yaross. Dan is the Director of Protective Services at Nationwide Children's Hospital in Cincinnati, Ohio. We'll discuss Dan's career, his experience with volunteer leadership, and the unique challenges his organization has faced in the last few months. And now, let's get into the show. Today, we're joined by Dan Yaross. Dan, thanks for taking the time today.
My pleasure, Brian.
I always like to start off by learning a little bit about our guest. So the first question I'm going to ask you is, who is Dan Yaross?
Thanks for asking. Not to be too boring, I'm a pretty typical average person, I think. I do try to strive to work hard. I think I got that from my parents and then my military career, but I also like to play hard. I think it's important to spend a lot of time with family, and I'm fortunate enough to have a wife of 45 years this year, and we have a daughter and a son and two granddaughters and two grandsons, and it's always fantastic spending time with all of them. And I just like to try to take on something. So it could be anything, a project, it could be when we buy houses. We've bought a number of homes since I was in the military. I always like to try to leave something better than when I found it, and always try to improve upon it. And I hope I'm doing that here in this current assignment and previous assignments as well. So that's pretty much it, pretty much average.
All right, fair enough. Could you walk us through your career path and just kind of explain how you got to the position that you're in now?
Sure, it's a little roundabout. I graduated from Ohio State University here in Columbus in the late 1970s, and then immediately entered the Army. Went through basic training and then officer candidate school, and then the artillery school. And then a year after I entered, after all the training, I found myself in Germany, first assignment as a lieutenant, and bounced back and forth between Europe and the United States with multiple assignments in the United States. And got back to Germany in the late 1980s, and was assigned to my alternate specialty, which was resource management. So it's like a budgeteer. And I was with the 2nd Armored Cavalry Regiment, and that unit had first of all, had a very long historical lineage and a lot of historical participation in the Old West, as well as more modern type of encounters. And we had the responsibility of patrolling the border between West Germany, East Germany, and West Germany and Czechoslovakia. So we had that portion of the border. And I was just a staff officer, so I got to the border quite a bit, but always as an escort officer for VIPs, like for dignitaries from the United States, congressmen, senators, that type, or from general officers from other countries that came up to see the border. So it was pretty interesting times. During that time, got to see something very, very interesting in history, which was the fall of the Iron Curtain. So that was pretty exciting to see while we were there. Soon after, my military police battalion, which I transferred over halfway through my tour in Germany, transferred over to the military police, which was my primary specialty. I came out of the field for training one of our companies, And it was a late Friday afternoon, early evening, and we were told that we were just put on notice to redeploy from Europe down to Saudi Arabia for Desert Shield, Desert Storm. So that was definitely exciting times. As a military police unit, we got to participate and conduct every military police mission that we're trained for. So it was pretty exciting and pretty involved in for those 5 or 6 months that we were there. And then came back to the United States and had a couple more assignments and retired back into Ohio. Worked different positions, found myself back into security, joined a national level company. We were purchased by what is now Securitas, and worked there for, in that organization for 4.5 years or so, and then found my way into healthcare, and I was hired into Cincinnati Children's Hospital as a supervisor, and then worked my way up to manager, and then director, which is system director, really. So did that for 11 years, and then came up here to Nationwide Children's Hospital in Columbus as the actual director for the department. And I've been here for coming on to 8 years now. So almost 19 years now altogether in just healthcare security. So that is brings you up to date to where I've been.
Awesome. And just given your career path, I'm assuming there is a good opportunity for you to learn from some other people. Who are some of your mentors coming up, and what are some of the things you learned from them?
I think all of us, we probably had mentors that we learned the positive things that we should put into our tool bag as leaders. And then there's also examples that you probably don't want to follow. And I've had, luckily just a minority number of those types of mentors, but still I had those. So you're wasting your time if you don't glean something from your colleagues or from your supervisors, and I always look to try to do that. I think the two, I almost have to divide this between my military career and then the private sector, mostly in healthcare security. So I say in the military, as a military police branch, it's a very small branch within the Army, and so there could be times, it's very rare, it could be times when there are 2 MP general level officers in the Corps. And that's because one's in charge of the MP school and one is in charge of the criminal investigation division. I was very, very fortunate that when I was a major, I was in Germany and I worked at the battalion where at the time Lieutenant Colonel Dave Foley, who is the person that became a general officer in the MP ranks. And he was one of those types that he was a big burly guy, always smiling, and just come up to every one of his, we had around 700 people in the battalion, and he knew all the senior people, all the officers and sergeants, and he would even know many by name of the privates within the battalion. He'd just come up to you in the hallway and yell your name and come up and give you a big old bear hug and take you a few seconds to recover and be able to breathe again. But he was that type of guy. Just generally cared about everyone that worked for him, and it showed. And unfortunately, we didn't go to war with him when we went to Saudi. We went with the person that replaced his successor, and he was the opposite. And you could really tell that he was really in the career just for himself. He really didn't care. And it really didn't appear that he cared for taking care of his staff. So I learned a lot about that too. And I had another officer when I was a company commander as a captain. I reported to another lieutenant colonel. He was actually the full-bird colonel in Germany that Dave Foley worked for. So again, like I said, the MP Corps was a pretty small branch. And this gentleman, this Colonel Clark, was a scholar. He was a gentleman's gentleman. And when he chewed your you-know-what because of something went wrong in your organization, he would do it in a very respectful manner. He'd even do it with a smile, but you got the message. And so Yeah, those are just my the military ones that really stand out to me. And in the civilian sector, two stand out. Well, one right now, my boss, he's lets me do my job. It's very rare that a director reports directly to the president, COO, especially of a large hospital. I'm lucky to do that. So we do put in a request many capital budget requests projects, especially large camera projects, and we're very fortunate to receive approval for most of them each year. So I'm happy there. He's an outstanding boss. Couldn't ask for anything better, and doesn't micromanage the department. And then the guy that really got me into healthcare security was Ron Morris. Many know him, and he was the senior director over at Cincinnati Children's Hospital. Taught me a lot. Still stay in touch with him quite a bit. We wrote many articles together that were published, and co-spoke at a number of ASIS or IHSS or even nursing annual conventions. So taught me a lot. We had same working mentality, and got along very well with him. And I have to show him so much appreciation for everything. Where I'm at now, I really owe to him. And then another individual that replaced him was Ed Casey, another gentleman, and knew a lot about security overall. And he was with Procter & Gamble for about 20 years, which was a huge organization. So he brought a lot to the table for us, and I followed him for a long time before he even came to the hospital. Very great learning opportunities. I've been very fortunate.
Excellent. Now, the main focus for our discussion today is to give the listeners an opportunity just to get to know the members of the board of directors of IAHSS. Obviously, you're in your first year as a board member. Can you share some of your experience in volunteer leadership with IAHSS and any other associations you may have been involved with as well?
Yes. To be honest with you, I really started when I was in private security. Although we had some work with healthcare, most of the, when I was a branch manager, most of our work was other types of industry, and it went all across the board. So I really started my volunteer leadership in ASIS International, still in that organization, still in on the Healthcare Security Council for about 10 years now. And I chaired that council for a couple of years. So before that, I was all the volunteer leader board positions in the chapter of Cincinnati Tri-State chapter of ASIS. And then once there, then I was asked and I stepped up to become a area regional assistant VP for that part of Ohio. And then also had areas in Kentucky, West Virginia, and Southern Indiana. So I did that and worked my way up to be the RVP for that region. And then from there, I jumped over to the Healthcare Security Council. During that time, down in Cincinnati, we had the OKI, the Ohio, Kentucky, Indiana IHSS chapter, and I served as secretary for 1 year there. But pretty busy with the ASIS side. So that's pretty much what I did down there. Up here in Columbus, took 7 years, believe it or not, but we finally mustered up enough interest and support. We created the Columbus, Ohio chapter of IHSS. So we're really proud of that. That started last November, so it's still a very new chapter and it's growing. On top of that, I was on the, as you're very acquainted now with this council, as liaison to it, Guidelines Council, spent 3 years with that IHSS design for the Council of Guidelines. And that was such rewarding, and it was a lot of work as volunteer type of basically giving back to our security, healthcare security industry is how I view it. And the people we work with and still are on that council are just, it's the who's who in healthcare security. You know, you got the Tony Yorks, the Tom Smiths, Kevin Toohey was on it, Lisa Terry, Mike Cummings. It's just, and it goes on and on. And so Dave Brown's now the chairperson there, and he and I worked a project together when I came onto the council, and just built so many great relationships from the council and still have them. And now working as liaison to the Education Council. And again, another great group of individuals that want to give back to, the profession, and they work very hard also. So that's pretty much what I've been doing in volunteer leadership, Brian.
Excellent. Now, in your current role on the board of directors, what excites you the most about the direction of the association?
I really think that the whole strategic plan, I, what I'm really interested in is not only the workplace violence group or workplace violence that we're working on, and in fact, on the design guidelines, put a lot of effort towards that as well. I really like, and I can't wait till it's really formed and we can start using is the data warehouse. I think that will be, really immensely helpful to all of us, that we can quickly glean data, do some benchmarking, and use that to help support any type of resources each of us individually in our organizations are requesting. And then really and we're already taking advantage of it here in Nationwide Children's, is digitizing all of our IHSS training. Our department was one of the first couple that took advantage and went into contract with IHSS to bring on the IHSS Security Officer Advanced and Supervisor courses into our learning center. That's going quite well. So everything that we're doing strategically with IHSS, I think, is just, the right direction, and pretty excited about where we're heading. And really, I know I haven't been a member as long as some of the other names that I mentioned previously, who's also been the chairs, president. Just what I've seen from, I think I joined like in 2002, memory serves, and the changes, the progress that this association has made since that time is remarkable in my mind. So I really like where we're going, and that's where I'm really focusing my volunteer leadership time now is IHSS.
Excellent. Now, being that you work in a children's hospital, I'd be remiss not to ask about COVID-19. Do you have any, I guess, challenges that are maybe specific to your location, or anything unique that you've had to adjust to for your environment?
Few things. So one, being a pediatric facility, we have seen, I think to date, only about 8 patients, and only one of those, to my memory, has really needed to be placed on a ventilator. So we've been pretty fortunate. We haven't seen any cases yet of the mysterious child-associated COVID cases that you're hearing now internationally. That part, at least from the patient side, we haven't seen an increase of what, every other, I think, children's hospital is seeing. Now, we have made a lot of, just like everybody else, made a lot of operational changes. We went down to only one visitor for 24 hours for an inpatient. So that means and they can't change out. So if mom starts during the day, dad wants to come in and take care of overnight, we don't allow that. It's one person for 24 hours, and that's it. A lot of people, we're having a lot of problems with visitors, family members, not understanding only one person can accompany, even an outpatient, up to an outpatient appointment. Only one parent, one person can accompany a patient. And so we've had what we call co-violent security. So it's anytime a non-patient is causing a problem and acting inappropriately, we have a process called co-violent security. And we've had a few of those for not only just visitors, family members, but even guest workers that just don't get it. So that's been the big thing. We also, just like everybody else, have really scaled back. So we don't have any face-to-face meetings. In fact, it's most, if you can work from home, the hospital administration has asked you to do that. So they asked all the department leadership teams to, instead of having everyone working the same day in case someone came infected or came in close contact with someone that turns out to be COVID-19 positive, we don't lose a whole leadership team for 2 weeks for quarantine. So we've been splitting up. So when I'm here, my operations manager isn't here. I have a parking manager also, so he kind of works in and out when either one of us is here. And then So that's a little bit different than everyone's getting used to Zoom, and we do Skype here in the hospital, but doing Zoom everywhere else. So it's interesting about how things have really changed operationally. And we still don't know what the new norm is going to be, but it's probably going to be a blend of what we're doing now versus what we did a few months ago before this really hit us. So that's pretty much how it's affected us. We've been running a COVID drive-up testing lane for over 2 months now, and that's been going very well. So I have a parking attendant that is assigned to the gate. I have a protective services officer that's in the urgent care lot that is controlling the traffic for the drivers that are coming up, either for themselves or for a patient to be tested. So that whole process has been working very well. The nursing staff is very, very efficient, and they turn around a vehicle once they enter the lane to be tested. They're in and out within 3 minutes. So that's been interesting. And I usually check on that every day I'm in the office just to see how it's going. So that's pretty much how COVID's affected us.
Okay. You raise a couple of points there. Now, one thing I want to kind of circle back to just with regards to COVID, the one thing that I've heard has been kind of a challenge for a lot of different healthcare security leaders is just access control. And the thing that was kind of unique about that was that a lot of the challenges were with staff. Have you experienced any challenges with staff just adjusting to the new changes?
To be honest, I think our staff has been very flexible. They get it. They really didn't pose much of a challenge at all. We had a couple thefts that people thought they could just take boxes of masks and gloves and things like that. So once a couple of people were caught, had them on video, and luckily some people, they saw something, they reported it to us, which was nice. So between that and then pulling it up on video, we confirmed that we did have theft and made them bring everything back. Other than that, we just had a couple of guest workers that presented a problem. They thought it was silly what we were doing, and they didn't see why they needed to wait. They needed to get a badge and get to the job site. And so we had some issues there, and we had to go to the sponsoring department. So it was construction workers who went to engineering, and they took care of the problem with their vendors. So we had a few of those. Mostly it was with parents. Luckily, it's not too many, but most of our staff have been very, very compliant. And in fact, when I was in the one of the main lobbies, one of the buildings, I was heading over to check on the COVID-19 drive-up lane. I heard one of the nurses at the front at the desk who issues masks to ask this person to put their mask on, and he came back very unprofessionally. I thought it was a visitor, and started saying, I'm not near him, but he just gave all these reasons why he wasn't going to wear his mask. So I went up to him, I said, why we have the mask policy, we expect everyone to follow it. And if you can't do that, then we don't need you to come back in this hospital. So then a little bit later, one of my sergeants said that I recognize that guy. I think he's an employee. So we checked it out, and he actually was not an employee, but was a guest worker. And he worked for a supply chain. And so I contacted the manager down there, and he took care of the situation like that. And we didn't have any more problems with that individual. So luckily, staff is fine. They get it. And they've been very supportive, and they contact us when someone is not cooperating with them. And so we have pretty good teamwork here.
Excellent. Now, you also spoke about how your organization's adapting and working remotely. Can you talk a little bit about that, how that's impacted you? You said you see a little bit of a blend of how things were before and how they are now. How do you think this is going to impact your operations moving forward?
That's a great question. And we keep asking ourselves that here whenever I'm in the office. To be honest with you, so all of our meetings that we used to do face-to-face, obviously now, is through Skype or through Zoom or something like that. And just last week, I had a number of meetings that were teleconference, displaying the screens of the floor plan designs for a couple of large construction projects, buildings and garages that we are getting ready to kick off for groundbreaking and all that for a little bit later this year. I'll tell you, Brian, we were just as effective. My poor eyes, I could see the designs much better on my own screen than I can, 20 feet away on a, projection screen. And it worked well. There are some glitches with communication, like when you have multiple people on Skype or Zoom or anything like that, it's hard to get a word in when you're trying to, and then two people start talking at the same time. So you kind of get used to that, and you get used to delays a little bit of, waiting your turn and being recognized. So it's a little bit different that way than it is face-to-face meetings. And I think the one thing you really, unless you're playing video also, which most of our meetings aren't, communication is much more than just the verbal speech of communication. It's facial expressions, it's gestures, it's the inflection of voice, and it's just, the mannerisms. So you kind of miss that part of the communication. So just like texting and emailing, I dislike that because I don't feel I'm ever getting across my message as effectively as I can in person. And I think maybe on the receiving end of communications, I might be suffering at times from that as well. Other than that, I think it's going quite well. We're finding that we can conduct business almost as efficiently remotely as we can in person. The one thing I don't like is I'm kind of a people person. So being a leader in the military and then, being in management ever since into the private sector, it's hard to lead from remote distances on phones. I'd rather be in person and talking with them and assisting face to face when I can. And when I'm away I do miss the interactions with my staff and with my colleagues here throughout the hospital. So that's the one thing I miss. So other than that, I think we're almost just as effective working in the telecommunications media.
Excellent. Yeah, it's definitely changed the way that we're doing things, but I think there's a good opportunity to kind of take the momentum from figuring out all of these tools first of all, and just leverage that moving forward.
Oh, absolutely. It's kind of funny watching commercials when they're taking off on Zoom now, like some insurance companies, and they have multiple people on a Zoom call, and it's just kind of humorous now looking at some of the awkwardness we all experienced when we first were forced into remotely meeting, but now it's almost becoming secondhand.
Yeah, and it's funny. I feel like people are actually adapting to Zoom, team meetings, and all these other platforms a little bit easier than they actually were to the conference calls. Like I find on the conference calls, you still have a lot of interruptions and people speaking when they shouldn't be, or people forgetting to
Right.
mute themselves. And
Yeah, you do. Oh, it's always fun watching the backgrounds, So, or hearing a dog bark, or seeing that teenage kid come into the kitchen where somebody else is broadcasting from and trying to find out where a food item is. So, those are pretty funny as well. But I guess, again, it's becoming secondhand. So everyone's dressed down, So my wife was asking me about that. She goes, "Why are you wearing just a sweatshirt?" I said, "Everyone does that. It's where you're working from home. Why do you want to get dressed up in a suit to work from home on a conference call?" So if I was going to be interviewed virtually, that's a different story. You're going to be in a suit. Other than that, why? Yeah, so it's kind of, it's just a different world, isn't it? But yet I'm amazed about how well everyone's really adjusting in the working world.
it's been interesting, and it's actually been great to see as well. Now, I guess just in context of our discussion today, is there anything I haven't asked you yet that you wanted to discuss?
Well, going back to COVID, when all of us were thrown into this, epidemic, pandemic, we're a short supply, well, who would have thought that you need to have this extraordinarily large amount of PPE stockage? Frankly, there's only a few, when you look at percentage of our typical staffing would need PPE at any one given time during a day. And now, we're all in it. When you look at masks, you look at gloves. Initially, only our medical clinical frontline staff, I put in air quotes, were permitted to wear N95 masks and to have access to the short supply of PPE. So I think one thing that we as healthcare security professionals need to look back on is how, I don't know how, I think a lot of our colleagues could say the same, but our security, parking, valet, even shuttle drivers weren't considered frontline staff. So, our people were not, allowed to draw from the PPE initially. I think that sends the wrong message, but yet they had to be prioritized who could get the PPE, and the ones that were, obviously working very closely with people that might have COVID, they definitely had to be prioritized to be provided the access to PPE. So I think that had a negative effect. I know it had a negative effect on our staff here at Nationwide Children's from protective services standpoint, because they didn't feel they're being respected or treated as frontline staff, even though often, our parking, our shuttles, well, not the shuttles, but at least our officers would be potentially the first ones encountering a COVID patient or family member that might have it, and weren't given the same priority as many of the clinical medical staff. So that's one thing that I think we need to really focus on, and maybe try to address that with our respective administration. And at least maybe now I'm sure we're adjusting the on-hand volumes of what should be maintained as normal stockage for PPE from now on. So I did see that, and I was a little disappointed at that, but yet I understood you have to prioritize, and I understood the thinking. I just wish it was a little bit more specified for different departments, people that work certain posts that would have potential direct contact. They should be given the same type of authorization for PPE as medical clinical staff. And, kind of reflecting back also on the volunteer leadership. I think you and I have had conversations in the past, as well as a lot of our colleagues, is, the reason why I got into volunteer leadership just, almost immediately after I first joined ASIS International was I just feel that, you get out of something what you put into it. And if you put in more, I think you reap much more benefit from your efforts. And so I've kind of worked that mantra for a lot of different things, but definitely within my career and as volunteer leadership. You don't get paid for this, but in a way you are being paid for it. It's just not monetarily. And I think that we owe it to our profession to continually help grow it, mature it, and add to it, and make it more and more professional. And that, I think volunteer leadership is one way of doing that. And I've really going through all the positions on the chapter boards in 2 cities, and then Healthcare Security Council, and then in the IHSS side. I just feel like I just get so much more out of the association. You build so many more relationships with it, volunteering. I think you glean a lot more information, and it's just building these long-term relationships. I think are so meaningful. Provides you the constant opportunity of networking, which is my main reason when I first joined these associations, and that's why I really enjoy attending the annual, the ACNE, and then the GSX for ASIS. It's just reacquainting, catching up, and then hearing about the latest and greatest things that maybe some of our colleagues are going through and hasn't affected your organization yet. And that's, to me, a huge benefit of being a member of IHSS.
Absolutely, I would agree with you. And even just in the last few weeks, speaking with Tony York, Lisa Terry, Roy Williams, they all kind of echoed the same sentiment. Martin Green, basically, no matter how much you put into the association, you end up getting more in return in, various non-tangible ways, but it's just such a rewarding experience. And hearing something like that from a guy like Tony York, who's, literally written the book on healthcare security management, there has to be some credence to it.
Oh, absolutely. Yeah. Because of, I've known Tony York Well, everyone's known Tony York. I've spoken to him just a few times when I was at Cincinnati Children's, but once I joined the Guidelines Council, he's still on it. He's a fantastic writer, and I think I shared with you previously that he and I share a passion, which is fly fishing, and so it's always a blast talking with him, working on projects with him. But again, like the other names you mentioned, golly, there's just so much information, knowledge, and experience that all the folks have that you mentioned. It's really a pleasure knowing and working with them.
Absolutely. And in closing, what message would you like to share with the Healthcare Security Cast community?
I mentioned already, it's important being a member. I think all professionals in healthcare security, if they're not a member of IHSS, they're missing the boat. So it's not much money annually, and it's an investment into one's career. And I think some people have a hard time spending money for what they think is work, but yet I think they have the wrong approach. It's their career, and it helps grow your knowledge, the information bank that you have. IHSS has so many, so does ASIS, but has so many benefits as a member that people don't take advantage of. And just one of the IHSS has the design guidelines as well as the operational guidelines. If a healthcare security professional doesn't have a copy of either one of those, again, they're missing it. I use those documents all the time. I even bought them for my engineering and information services as well as the planning departments. And we created a document which I shared last year when I presented with my engineering and the behavioral health project managers about our new pavilion that we opened up a few months ago. And we use that as setting security technology standards. So we place for every type of occupancy within a healthcare or hospital arena, we have these minimum standards for cameras, card readers, panic buttons, duress buttons, door contact alarms, lockdown buttons, so that we don't have to debate and extend out these meetings even longer than what they already are. When we talk about a renovation or a new construction project, we already have, and we give it to the architects so they can quickly put in our security plan. So access control as well as video management. So we don't have to argue every one of these items. And it says all we have to do is tweak the locations and the numbers on these plans for the architectural design. So we think that was a big win. Again, just those two little books has so much information packed into them that I just don't understand a security professional in healthcare that wouldn't have access, wouldn't take advantage of having access to those documents. They really helped me in my current position here. And then again, volunteer. We need help. We need more people coming up. Younger people need to be stepping up. We need to introduce them. And we need to get as many of our individuals trained as we can and joining into IHSS to really increase professionalism within our ranks, I think. And in fact, I did that with our department. They weren't working IHSS when I first got here. So we implemented that, the basic, the advanced, and the supervisor courses, but tied them into, we created a career ladder here and tied in each one of those certifications to prep them for the next promotion. So when they join us, if they're not promoted twice within 24 months, it's their fault because we make it, low-hanging fruit. It's very easy for them to take advantage. And we think that we're getting a much more highly trained and professional officer this way. So I would say join, get your folks in, get them trained with the certifications, and keep spreading the word about IHSS within our arena.
Excellent. Now, just one last thing, Dan. How can we connect with you?
So I'm going to apologize in advance, but my email address is rather long because someone beat our hospital to the initials of NCH. So Unfortunately, it's long, but it's Dan Yaross, Yaross, at Nationwide Children's, that's with an S.org. Phone number in the office is 614-722-2126. And cell phone is 614-542-9354. I always encourage people to never hesitate, reach out. They want a policy, procedure, benchmark with us. We're always happy to share all of our policies. All the experience we had with different things. And just one of those examples from last year, immediately following the AC&E, I had a couple of contacts that, could you please share the security technology standards that you guys created so we can start that? And we're happy to do that. So again, I think that's part of being good colleagues and helping each other. And it's not like we have trade secrets in the security industry. It's not like we're hoarding secret or top secret information. So I never understood people that wouldn't share their own policies, procedures. So luckily, most of the people that you encounter in IHSS, no issue. And in fact, if you can't reach them immediately on the phone, it's rare that someone doesn't call you back and doesn't call you back fairly quickly. So again, that's part of the networking and being an active member in IHSS. It's definitely a win-win situation.
Excellent. Well, thanks again for taking the time today, Dan. I appreciate it a lot, and it was great talking with you.
Ryan, it's always a pleasure speaking with you, and I'm hoping we get to see each other here in a few months.
And this concludes another episode of the Healthcare Security Cast. Thank you for joining us today, and thank you for helping us hit 2,500 downloads in 36 countries around the world. All of the support of the podcast is very much appreciated, so thank you again. As always, I encourage you to engage with us on social media, and you can connect with me directly on social media. I'm the only Brian Hamilton, BRINE, on all of the major platforms. Also, you can visit my website, brianhamilton.com, for links to all of our Healthcare Security Cast pages. One quick announcement before we go as well. The IAHSS AC&E, that's the annual conference and exhibition, has moved to an online virtual format. Click the link in the description for more information on that. Join us again next week when we're joined by Randy Calentis. Until next time, stay safe and take care.